And good morning. It's 7:04 on this Tuesday, August 15th. It's time to head to Studio B for Coleman and Company.
Hello, everybody. Welcome. Tuesday morning, the sun is shining. We welcome you to our program, and it's all presented by Vanderbilt-Wilson County Hospital. Tracy Pope is here. Good morning.
Good morning, Coleman.
Tracy is Director of Community Relations for Vanderbilt-Wilson County Hospital. Brings us a guest most Tuesdays when she's here, and today is no exception. We'll get to that in a moment, but what's the latest with you?
Well, like you were just asking, we are getting ready for the Wilson County, Tennessee State Fair. The hospital has a long history of supporting our local fair, and now that we are a state fair, we still are honored to support that. Vanderbilt-Wilson County Hospital is the official medical provider of the Wilson County, Tennessee State Fair. We have a huge sponsorship, lots of aspects, and we are just getting that all organized and excited to kick it off on Thursday.
I think you've had a booth on the outside of the Turner Evans building for years. Will you still have that?
Correct. Yes, and it has evolved over the past couple of years. We have a huge Vanderbilt Center of Women's Health practice here in Wilson County, and so we have had the Mother's Lounge for the past several years, and that's a cool, clean area for any mother to change their child's diaper or breastfeed or just have a moment to sit down and take a minute in the chaos of the fair. So that's what we have in the Turner Evans
Well,
booth.
no doubt that's much appreciated.
We hope so. It's been pretty successful the past couple of years. It's right in the main walking space, so everyone sees it, and it's there if you need us.
All right, are we ready for our guest this morning?
Yes. We're excited to introduce Dr. Melanie Hicks. She is Vanderbilt Ear, Nose, and Throat here in Lebanon. We have several physicians that are coming into the practice with her, all a little bit different in a specialty of ear, nose, and throat. I didn't realize how many different specialties there were, but Vanderbilt is bringing them all here to Lebanon, so we're excited to hear from Dr. Hicks.
Well, Dr. Melanie Hicks, good morning.
Good morning. Thank you for having me.
Well, we're sure glad to see you today, and we want you to tell us a little bit about yourself.
Yeah. So I grew up in the Midwest in Minneapolis, Minnesota, and I, decided to go to medical school in Minnesota and did my residency at UAB in Birmingham, Alabama. So came down south, and then have been in Nashville for now coming on a little over a year.
What got you into the medical profession? Is it something you thought about when you were 5 years old or 10 years old, or did you wait till you were almost an adult?
Honestly, it was a pretty gradual kind of discovery process. I liked science. I just kind of started on the pre-medical track in college, and then really liked working with people and in the hospitals. And so it wasn't something that I knew that I wanted to be from the time I was 5. It just kind of developed naturally, I'd say.
Well, you said you came all the way to UAB.
Yes.
I believe. And that's a good ways south of where you were.
It is.
Why that?
Yeah. Well, I had lived in the South. I went to college in Atlanta at Emory University, and so I was used to living kind of in the South, but my husband is a pulmonary critical care fellow at Vanderbilt, and so we ended up couples matching, so entering the match together after medical school, and we both interviewed at UAB in Birmingham and just absolutely loved it. And the winters are far nicer in the South than in Minnesota, that's for sure.
Well, that's a little bit about yourself and where you were trained, and tell us about specifically by coming to Vanderbilt and then Wilson County.
Yeah, so I did a 5-year residency at UAB in ear, nose, and throat, and I wanted to further subspecialize in head and neck cancers and tumors and reconstruction, which is a 1-year fellowship. And so I was lucky enough to match at Vanderbilt for that 1-year fellowship, which I completed this past summer. And specifically Wilson County, the opportunity arose, as you know, after Vanderbilt bought the Wilson County Hospital a couple years ago, and we've been trying to develop a broader ENT access in Wilson County, specifically for head and neck. And so I was really lucky to be a part of this outreach program and provide better access to patients so that they aren't having to travel all the way to Nashville, and we can provide some of those specialty care here.
How long have you actually been here?
So in Nashville or in Wilson
No,
County?
in
Wilson County.
Here.
I just started my practice, so a couple of weeks ago. And so I'm just starting to see new patients.
So you're brand new.
I am brand new.
Yes, and Dr. Hicks, it's been fantastic to work with her. We met several months ago when she was planning to come here, and one of the first things we are doing is here on the radio. So pretty exciting that she's starting her practice, and she's going into the practice with Dr. John Tate. You know, he's been a staple here in our community for many, many years, and he is retiring very soon. And so as he retires, Vanderbilt knew that there would be, a shortage in ENT, like Dr. Hicks said. And we're just excited that Dr. Hicks and several others are coming here to Wilson County.
Well, what's it been like so far? I hope you've felt welcome.
It has been fabulous. I've been lucky enough to have been taken around to some of the local primary care offices and meet some of the other local ear, nose, and throat providers, and everyone is incredibly welcoming, and I hope to provide good care and good access for patients.
Well, the Vanderbilt Ear, Nose, and Throat treats a wide array of diseases. It offers comprehensive care, so we want to talk about some of this. Tell us more about what's a head and neck specialist focuses on.
Yes, so a head and neck specialist focuses on benign, so non-cancerous and malignant or cancerous tumors of the head and neck. So the skin of the face and neck, ears, outside of the ears, lips, mouth, tongue, and throat. Some of the most common malignancy that I treat is called squamous cell carcinoma, but I also treat a lot of benign lesions, so things like thyroid nodules, enlarged thyroid, and any benign tumor of the salivary gland, so the parotid gland, the submandibular gland, really any lump or bump within the head and neck, and any reconstruction that requires.
Well, you're this is you're quite specialized. It
Yes.
sounds like.
Yes.
And how long, how difficult to understand and know how to gain the expertise you seemingly have for this.
How long it took to, so it was 5 years of residency training. So I do provide care for general ENT as well. And so I'm a board certified general otolaryngologist or ear, nose, and throat doctor. But I have that extra year of training in more complex tumors of the head and neck and the reconstruction that oftentimes it requires after we've taken a tumor out.
How common is what you're dealing with, especially pertaining to cancer?
Yeah. So it's, in terms of how common head and neck cancer is, it's the 6th most common cancer worldwide, but it's relatively uncommon in the general population, although, of course, I'm biased because I see a lot of it. And it's also very regional. And so in areas with a lot of smoking, or sun exposure, we see a lot more head and neck cancer. But we can talk about, some of the risk factors for head and neck cancer. Going off of that question. So a lot of the most common risk factors for head and neck cancer are tobacco use, so cigarettes and smokeless tobacco or chewing tobacco, and alcohol consumption. We tend to see head and neck cancer in patients starting in their 50s and older. And then when we talk about head and neck skin cancers, the most common risk factor is excessive sun exposure, and any state where your immune system is being affected. So patients who are on chronic immune suppression therapy after a transplant or autoimmune diseases, skin cancer is a higher risk for those patients as well.
Well, is surgery usually the way this is dealt with?
So it depends. Surgery, of course, that is what my specialty is. And so it really depends on the type of cancer or the type of tumor and where it is located. A lot of the times, the two most common treatment options are either surgery or non-surgical therapy, which includes a combination of radiation plus minus chemotherapy. And how to make that decision about what the best option is really depends on the size of the tumor and having a detailed discussion with the patient and understanding what's right for that individual patient.
So it just depends.
It does depend on a lot of factors.
Is surgery usually a last option?
No, a lot of the times it's actually the first option, depending on where it is and what type of tumor it is. Certainly, for smaller tumors, a lot of the times we will go towards surgery first. Radiation is usually 6 weeks, 5 days a week, and so it's a hefty toll on a patient. But a lot of the times, it just depends on the size and where it's located. But again, this is a conversation we have with, it's not me just making the decision. I work with a multidisciplinary team of radiation and oncologists and medical oncologists and other surgeons. And a lot of the times we'll get together and come up with the best plan depending on the patients.
And then the patient usually has the final decision.
Exactly. Exactly.
But if one is depending on professionals to advise, you want to offer the very best advice and what's best in that particular situation. So hopefully they listen.
Absolutely.
All right, our program presented by Vanderbilt Wilson County Hospital. Dr. Melanie Hicks is with us along with Tracy Pope. This is Coleman and Company, FM 98.9.
And let's see what's happening on the roadways. Thanks to Bates Ford, get a regular oil change. It's $39.95 up to 5 quarts oil, tax and disposal. 1673 West Main. Now at traffic, here's Chuck.
Good morning. I still see slow-go traffic through Kingston Springs this morning on 40 going eastbound through that section of Cheatham County. Keep that in mind if you're coming in from Dixon County. It's pretty heavy now. It's 24 westbound up through the Hickory Hollow area and leaving Murfreesboro headed towards Nashville. It's also a slow-go on Vietnam Vets westbound as you get on that ramp to 65 going south. Princess Hot Chicken is catering. Check out that menu today at princesshotchicken.com. I'm Commander Chuck with your on-time traffic.
Renewal happens here at Lebanon Center for Rehabilitation and Healing. Lebanon Center for Rehabilitation and Healing has experienced new leadership and a new atmosphere. Same location in the heart of Lebanon, 731 Castle Heights Court on the Castle Heights campus. Lebanon Center for Rehabilitation and Healing is providing 5-star clinical outcomes to short-term and long-term care residents. Call 615-444-4319 for a tour and to experience the new culture. Renewal happens here at Lebanon Center for Rehabilitation and Healing.
What is your passion? How can you use that passion to enrich your community? Hi, this is Melanie Minter, President and CEO of the Lebanon-Wilson County Chamber of Commerce. Your chamber is the resource for making connections to fulfill your passion. Whether education, nonprofit, agriculture, entertainment, or government relations, Wilson County offers a place for you to be involved. Your chamber connects businesses, individuals, and your passion to the community. We have an enthusiasm for excellence. Join us and catch the spirit. Call or visit our office at 149 Public Square in Lebanon.
Coleman and Company, thanks for joining us here on a Tuesday morning. Each Tuesday and twice a month, Tracy Pope comes out, brings us a medical professional. And Tracy, you haven't said much this morning, but
I haven't needed to. This has been a fantastic presentation, Dr. Hicks. We have not had this type of specialty here in Wilson County in many, many years. Vanderbilt purchased our hospital 4 years ago, and our goal, our credo, is to bring excellent care closer to home. And I know, we can't possibly bring every single specialty to Wilson County, but we sure are making strides. And we're very fortunate that if you are not able to get the specific care that you need here in our community, Vanderbilt is so close with their locations around Davidson County, around Nashville. But we have brought over 30 specific service lines to Wilson County since we became Vanderbilt 4 years ago. So we're very proud of that.
well, Dr. Melanie Hicks again with us this morning, and you kind of hit the nail on the head earlier when you were talking about if you can come to Lebanon and not have to go to downtown Nashville. And there's just something about the big city that and all the traffic that you'd like to avoid if you can, plus the extra time that's involved. and you probably hear a lot about that.
Oh yes, that is something that was one of our goals when we started this effort to bring head and neck services and expand our ENT access out here in Wilson County. Is, it's a lot for patients to travel to Nashville and park and deal with. It can be a little overwhelming, and especially if it's a situation where patients are having to travel multiple times a week for different appointments. And so just being able to offer our service closer was something that was really exciting for me.
Well, let's talk about your office, where it's located.
Yeah. Our office is located at 206A Babb Drive in Lebanon, so right next to the main Wilson County Hospital. It's a white building. It says Vanderbilt Ear, Nose, and Throat out front. Easy parking. Walk right in, and the lobby's right there, which is nice.
Are you taking new patients?
Yes, absolutely, taking new patients.
What's a week going to be like for you? Because you're doing surgery, you're seeing patients, you're doing a lot of different things, and I imagine when you get going, of course you've only been here a short time, but you get going, going to be pretty regimented. And on this day we do this day we do surgery. Is that the way it kind of works?
Yeah, absolutely. So right now, I'm seeing patients in clinic on Tuesdays, and then I'll open up a second clinic on Wednesdays. And so that's probably what it's going to stay, is Tuesdays and Wednesdays. And then I operate at Wilson County, both the ambulatory surgery center and the main operating room on Thursdays. And then I also have privileges still at the main Vanderbilt downtown hospital. And so what's nice is that any patient who has a more aggressive tumor or a more complex tumor that requires a little bit more surgery than what we can offer at Wilson County, I can offer that service at the downtown location and have that continuity of care.
We might talk more about the various surgical options, because I know a lot depends on the type cancer. It also depends on where it is, and we're primarily talking about ear, nose, and throat this morning, and that's kind of all part of our head, and it's a delicate area.
It is.
And so I think it's got to be a little bit different surgery on your head or neck or ear or whatever than it might be on your foot or leg or something.
Sure, absolutely. And that is something that, a lot of the times surgery can affect some of the, swallowing, speech, breathing, things like that, because exactly as you said, it's such a high real estate area. And that is, of course, something that we discuss at length with the patient, again, depending on the size of the cancer. But ultimately, we work with various other disciplines such as nutrition and speech therapy, and our radiation doctors, supportive care doctors, to make sure that, if we do have to perform surgery that could have some quality of life changes, that we provide patients with as many resources as possible moving forward to recover from this procedure.
Well, I feel sure that if you're dealing with somebody who is a smoker, smoking cigarettes especially, or using tobacco really, that you are encouraging them to stop, to quit, get off of it. You're kind of a coach in a way, aren't you?
Yes, absolutely. And that is, one of the, smoking cigarettes is definitely the greatest risk factor for the development of head and neck cancer, but it's a habit that, I understand is very difficult to quit. And thankfully, we have a lot of resources, both medications, patches, lozenges, pills, and, other therapeutic options that we can offer the patients.
Well, what if someone does quit compared with someone who doesn't, and the future and the cancer you're dealing with? And sure, it depends on a lot of things, but the overall situation, I'm taking it is so much better if they can stop the smoking.
Absolutely. So we know that even just having had a history of smoking increases your risk of head and neck cancer. But the best thing that you can do if you have a diagnosis of a cancer that is caused by smoking is to quit smoking. That we know that improves your chances of survival.
Well, I've always wondered, what is it about that causes the problem? How does smoking a cigarette cause the cancer? Can you talk a little bit about that?
Yeah.
Now, Coleman, you're getting into an area that's not really her aspect.
Just like, so that's a great question. And the smoking actually, the smoking, the materials within the smoke and the tobacco actually changes the cells of your skin that lines, your tongue, your throat. And so over years and years and years of exposure to these, what we call carcinogens within tobacco and other tobacco or smoking and other tobacco products, actually changes the cells and cause them to have a dysregulated growth pattern.
But what you are saying here, if I understood you correctly, is that a lot of the problems that you deal with are directly caused by the tobacco use.
Yes.
Okay. Well, I guess that's enough said there.
Yes.
A warning to the wise.
Yes.
Anything else? Again, we hear so much about breast cancer. Reproductive areas, men and women cancer, but we don't hear as much, I don't think, about what you're actually dealing with. But you're dealing with this all the time, and it's there. Just sort of a different type of cancer, but it's good to have somebody that knows how to deal with it.
Yes. And I would say, any lump or bump or spot that's not going away, that's starting to bleed or hurt or get larger, I would say always the right thing to bring it up to your primary care doctor. We are open and love to see new patients and help out. And so primary care doctors can reach out to us. Your local ear, nose, and throat doctor can reach out to me if there is concern, and we're always happy to help with the diagnosis.
Any other symptoms to talk about regarding that?
Yeah, I would say in general, things I just mentioned in terms of, painful spot in your mouth or problem swallowing, difficulty, swallowing and pain with swallowing, any sort of spot, lump, bump that is new or getting larger, hurts, bleeds, that's associated with weight loss. Those types of symptoms are concerning enough that you should seek medical
One
advice.
other thing just came to my mind. Do you deal much with young people, let's say people under 30, present with things we've talked about here?
Absolutely. And we do see it, although it is rarer to see a patient under 30 with head and neck cancer. Certainly, we do see that. A lot of the patients that I treat who are under 30 have benign or non-cancerous lesions, such as tumors in the thyroid gland and the parotid salivary gland that's in your cheek in front of your ear. And so it definitely is a different patient population, but one who I also treat.
Well, if one has a growth like that as non-cancerous, do you deal with that as well?
Yes, absolutely. We deal with that.
It's not life-threatening, but sometimes for appearance sake, maybe they
Absolutely.
want to get rid of it.
Absolutely. And there's, tumors that are non-cancerous of the thyroid and the parotid gland and submandibular gland. It really depends on the patient and the patient's preference and how likely it is to turn into a cancer. Some of these are slow growing and take years and years. Some patients want it taken out sooner rather than later. And so it really is, again, that discussion with the patient to understand what their goals are.
Okay, well, let's remind everybody you are taking new patients.
Yes.
And your office location one more time.
Yes, it is 206A Babb Drive in Lebanon.
All right, Dr. Melanie Hicks, Vanderbilt Ear, Nose, and Throat. real new, just been here a few weeks, and we appreciate you being with us this morning.
Thank you so much.
Tracy, I guess back to you to kind of wrap things up.
Yes, and I have to make a correction of myself. I misspoke. So I meant to say in about a 30-month period, we have brought about 17 additional service lines. So I don't know how I messed up on that, but I wanted to correct myself. About 17 additional service lines since Vanderbilt had purchased our hospital 4 years ago. So, like I feel like you're wanting to.
Well, you have no doubt Vanderbilt has spent a ton of money, maybe several tons of money, and that's my crude way of explaining this, but much has been spent to upgrade the hospital.
Yes. I mean, as a person that has worked in the healthcare field for a significant amount of time in this community, we could not have asked for anything better for our hospital, for our residents, for Vanderbilt to purchase our hospital. And, that was the first time that Vanderbilt had purchased a hospital. A lot of people don't understand that. They have joint ventures with the lots of healthcare entities, but they had never purchased a hospital until they bought our hospital here in Wilson County. So it's been a fantastic 4 years. I can't wait to see what the next 10 years brings. I'm so glad that Dr. Hicks is here in our community. And, we were just talking ahead of time. She's going to bring her daughter out to the fair this week and enjoy all the things that Wilson County has to offer.
Well, you just mentioned your husband. You
Yes.
have the one daughter? Or?
Yes, I have one daughter, and we're expecting another baby here in the fall.
All right. Well, thank you so much for being with us, and welcome to Lebanon. We hope it all goes well.
Thank you so much for having me.
All right. Dr. Melanie Hicks, Vanderbilt Ear, Nose, and Throat, along with Tracy Pope, and that is part one of Coleman & Company, presented by Vanderbilt Wilson County Hospital. Stay with us for more here on FM 98.9.
And let's see what's happening on the roadways. Thanks to our friends at Absolute Kubota, high performance, high horsepower, 0% financing is still a thing. Now is the best time to save on new Kubota L-Series tractors, rated #1 for durability and owner experience in the U.S. Absolute Kubota, 1506 West Main. Now at traffic, here's Chuck.
Good morning. They're wrapping up an accident where car's up against the wall in a terrible spot. It's 40 westbound at Spence Lane. This is aggravating that traffic now coming past B&A Airport in Donaldson on 40 westbound. It's heavy, of course, this time of the morning as you come out of Wilson County, especially the Mount Juliet area headed towards Hermitage. Heavy traffic trying to get up through the Hickory Hollow area on 24 westbound here at Bell Road. It's still a little bit sluggish with that slow traffic in Kingston Springs on 40 going eastbound through that section of Cheatham County. It's been a mess out there for the last week or so. Prince's Hot Chicken is catering. Log on to princeshotchicken.com. I'm Commander Chuck. You're on time traffic.
Welcome to Hearthside Senior Living, Lebanon's unique senior living community designed for seniors to age in place, all within a safe, comfortable, and Christian environment. Beautiful retirement homes designed for an independent lifestyle with maintenance-free living. Hearthside Senior Living also continues the excellent tradition of assisted living for those seniors who need additional services. Hearthside Senior Living, an independent retirement community and assisted living community, all on one campus in the heart of Lebanon. Call 615-443-1994 for a tour.
Cooler temperatures today around the region. Mostly sunny skies, a high of 79 degrees. Tonight, partly cloudy, back down to 61, 80, the high for Wednesday. This weather forecast brought to you by Walker Auction and Realty. Professional auction and real estate services. Get top dollar for your home, land, or personal property. Just log on to MikeWalkerAuctions.com. They know auctions. Let's look at your forecast. I'm Stormy Clausen.
We welcome you to part two here on a Tuesday morning. John Dozier, good morning. We have a lot of conversations during the break, don't we?
Yes, we do. Yes, we do.
But see, we got this little bumper music that's going, and
I can't even hear the bumper music.
Well, that's all right. We welcome you again. You're here just about every Tuesday to talk about Hearthside.
I'm here every Tuesday. Before I do talk about Hearthside, I want to mention Wilson Rides. I'm on the board of Wilson Rides, and we have a board meeting today, and I wanted to mention these people who help us, who are drivers and some riders as well. Eddie Carroll, Barbara Alexander, Ginger Naylor, Ingrid Hamilton, Evelyn Lanham. They're drivers and riders, and if you're a senior out there and you don't want to use Mid-Cumberland, or you don't want to bother a family member, or you don't want to use a taxi, you know, Wilson Rides is a great nonprofit organization that provides transportation to seniors. And I just wanted to mention those folks. We like to do that every once in a while, and
Yeah.
I appreciate that. We also, Coleman, I brought you something today. It's a nice pen. It's a $30 pen that we give to people who come in for tours. And you know, you have I don't know if you have a Hearthside pen, do you?
I
Well, I want
Vanderbilt Wilson.
Well, no.
There's Hearthside.
I wanted to give you a nicer one today.
Okay.
We're going to give these away also at the senior night at the fair on Tuesday, next Tuesday from 4 to 6. I saw Helen there last year. I don't think I
Yeah.
saw you, but she came by the booth, and
I was probably working while she.
you
was
were probably
playing.
working. That's right. Well, she was there. She was there getting all the free stuff. So I'll see her hopefully this year. But I wanted to give you this so you can use it on Tuesdays when I
well,
come out.
thank you.
I gave
very
MJ
much.
one. I gave Billy one. I gave the director of schools
That's a
one.
cross pen.
Yeah.
It says so.
Yeah.
Oh, that's nice. Thank you.
Yeah, I wanted to give everybody one.
Yeah.
I wanted to keep the director of schools happy too, since my wife teaches 4th grade. So I wanted to make sure.
I gotta try to take a look.
Yeah,
at
take a
that
look at
one.
that.
Oh, yes.
Isn't that nice?
Thank you.
Has a Hearthside logo on it.
Yeah, good. I will write with that each Tuesday when you are here.
Well, we give those to people who come in for tours. In fact, yesterday we had 3 walk-ins. We had a young couple, Coleman, about 25-year-old couple, and just got married, and her grandfather just passed away, and it's kind of left up to her now on helping her grandmother. So she was looking for an assisted living for her grandmother, and we were able to help her out, and they're going to come back Wednesday and bring her and hopefully move her in. So that was nice to help them out yesterday. They're young. They're kind of, this has kind of been dumped in their lap. So it was nice to walk them through the process. And then another lady came by yesterday wanting information about the independent living homes. And so we gave her information on that. We're going to give her a tour later this week. And then another lady who happened to be visiting her mom at Hearthside, somebody everybody knows, said, "Hey, tell me more about these houses." And I want to hear more about them. And so I was able to walk her through the process of that. So yesterday, as we do every day, we walk with people through their lives and really help them figure out the next steps. And sometimes it's not easy. Sometimes you got to rip the Band-Aid off, as I like to tell people. You can drag it out or you can rip the Band-Aid off. And so we help people walk through that process. But it was nice to talk to those folks yesterday. And if you're needing, right now we're full. We do have that one room available that I think that lady's going to take. But if you want to get on the waiting list for the assisted living or the independent living, we'd be glad to talk to you and walk you through the process. It's not like you move in the next day. It's a process. And we like to encourage people as they go through that season of life.
But I keep insisting and keep it out before the people that if you weren't doing a good job, you probably wouldn't have that waiting list.
Well, we a couple years there during that COVID thing, we kind of went down a little bit, but things are back to normal and we're full, and we have a waiting list, and we have tours every day. I'm telling you, even on the weekends, people are coming in. We're a growing city, a growing community, and assisted livings are needed. And it's not just people that have grown up here and lived here. It's people that are moving in here as well, who are bringing their families with them, who are needing those services. So we're glad to be a part of that, and I appreciate coming out here every week to talk about it.
Not meaning to pry or whatever, but are there any plans for expansion? I mean, as you grow, there's a bigger demand.
Yeah, well, we've got a committee that we're forming to talk about the future of Hearthside the next 10 years, and so that's going to be a part of our discussion.
Yeah.
I need more rooms. I need more homes. I'd love to expand that property, but we're kind of landlocked a little bit. But I hope to offer more services in the future. And
well, there is such a thing as getting too big, and you have to include that in your
That's right.
discussion, of course.
That's right.
You don't want to get so big that you can't still be Hearthside.
That's right. We're a unique community, and we've always been that unique community. We're not for profit. We're nonprofit. We're a ministry, but we're also a business. But the main focus is that ministry aspect to it. So I don't want to lose that.
Well, I hope you make the right decision. But
Thank you.
If you can increase a little bit, I think a lot of people would be pleased.
Thank you. I'll take that back to the board. We have Coleman Walker's endorsement to build more homes.
Well, I know that's good. Are you ready?
Yeah, I'm ready for a Hearthstone. Hello, I'm ready to move on and pass it on to Brian here. my Hearthside hello is a lady I think you know, Kathy Davis. She is at the Senior Citizen Center a lot. She knows you and Helen.
Oh, yes.
And she stopped by yesterday, and she says, I hear you on the radio. I hear you and Coleman. I listen to Coleman all the time. So I wanted to, she's listening this morning, so I wanted to mention Kathy Davis.
Well, great. A happy Hearthside hello.
Thank you.
Well, that kind of when we get to that, that's about the time for you to leave.
That's it.
We appreciate your visit each week. Thank you for this.
You're welcome.
I appreciate that.
You're welcome, and I'll see you.
You'll sit in my pocket next Tuesday.
I hope so.
If all goes well.
I'll see you next week.
All right. Sean Dozier, Executive Director, Hearthside Senior Living, Retirement Assisted Living Community at 215 Castle Heights Avenue North in Lebanon. That phone number is 615-443-1994. 1994, of course, the year that it all began. Okay, we're about 21 before the hour, and Brian Hutto is with us this morning. Mr. Hutto is the Director of Schools for the Lebanon Special School District, and here this morning to tell us all about school getting started.
Sure. Good morning, Coleman.
Good to see you.
Super excited to be here. Of course, we've kicked off school, and we're all educators and all the grown-ups, and we really, we get fired up when our students return and welcoming new families. So since our last time actually you and I spoke, we had a board meeting in July. We passed a budget. We had a packed agenda, 2-page agenda, which isn't always the case. But today I want to talk about some of our agenda items, but then we'll talk about school starting.
All right.
Really
like
excited. Yeah, sounds good. So, hey, big thing on our agenda, our board, 6% raise for our classified and certified personnel. Really, I can't brag on our board enough. The thoughtfulness that went into our budget, it's a big budget.
Yeah.
It's a big budget, and it reflects our growing population, which we'll talk about enrollment here in a minute. We're pretty stable with enrollment. We were watching trends at the end of the school year, so we haven't had a huge influx, which is nice. It's nice to be able to take a breath and take care of those that are here. But the board, we went through, we crunched numbers. The state allocated more funds for school systems, and the state also indicated that those funds need to go to raises because teachers deserve it. And we say all the time, we don't pay them what they're worth. And your wife was in the school as an EA, and it's a mission field, but we wanted to be able to do this, and we were able to. So 6%, Coleman, that was the biggest raise we've given, I think, to date. We've always done a raise. Historically, Lebanon Special's always done one, but 6%, it was nice to be able to say that.
Well, one of the things we've been hearing, even here in Wilson County and in other counties too, is a shortage of teachers. Have you experienced that?
We're blessed, and we have experienced it, but not to the degree. But having a smaller size, we're able to attract and recruit and go after. So if we have a vacancy, we feel it. And you may hear some of these larger systems, they'll have 50, 60. If we have 3 or 4, we are feeling that. And so our principals do a great job. We start the process back in March. We go ahead and decide who's retiring, where do we have growth needs. And so they're quick to jump on. So as it stands, we've got some special ed positions that we need to fill. And we're recruiting and looking, and no one is going without at this point. But it would be nice to be able to have some extra folks in there. And, of course, bus drivers, growing community. We're adding routes. So if anyone's interested in driving a bus, we've got a great setup, training program, a bus aid.
Really, for the hours spent, the pay is pretty good.
Pays really good. Pays really good, and we take care of all of our employees. But we really, that's the first interaction a child may have each day, and the last one. And so we really want to take care of them, make sure they have what they need, have the training that they need. And so it's a good gig.
I think we've talked about this a little bit in the past, but I believe you may be in a position where somebody could drive a bus only in the morning or only in the afternoon.
That is correct.
And you're flexible in that way to help them be flexible and meet their situation.
That's correct. We've learned over the last few years, and I think COVID may have taught it to us. I'm not sure, but flexibility is the name of the game, and that can be with positions. The state's recognized the shortage, and so we can bring in retired teachers and make them full time, and it doesn't necessarily impact their retirement, which is nice because you have people that want to. And so, but for bus drivers, yes, if you're interested in one morning route, we'd be happy to do that.
Well, we could could sort of coin and change this expression just a little bit, but once an educator, always an educator.
Oh, yes, sir. Yes, sir. It never leaves you, and we're blessed to have folks that do that, and they'll come back in and continue their tenure, and so we're excited about the school year, though.
And pick up a few coins in the meantime.
Exactly. Pick up a few coins.
Okay. Well, we need to go to a break in a couple of minutes, but anything else you can tell us quickly here?
Yeah, so when we come back from break, we had several initiatives with our budget. Safety was a huge one. The board, another pat on the back for them. Really were thoughtful in the process of how we're going to allocate funds. And previously funds were distributed, but we made it a point of emphasis, along with our strategic plan, that we implement safety protocols, additional. So there are seen and unseen. Some of them I'll be able to talk about. Most of them we can't. Legally, we just can't share all the details, but really, really excited about what we're doing. We've got data that we'll get to share next time. Next radio show, we'll be able to talk about the great things our teachers have done. So, yeah, when we come back, we'll talk some safety.
Okay. Break here. Again, Brian Hutto, Director of Schools, my guest this morning. You're on Coleman & Company, FM 98.9.
And let's see what's happening on the roadways. Thanks to our friends at Bates Ford, the Works Vehicle Checkup. They'll make sure your vehicle is ready for any road. $59.95 up to 5 quarts of oil, tax and disposal, tire rotation, and safety check. 1673 West Main. Now at traffic, here's Chuck.
Good morning. It's still running pretty slow go on 40 eastbound through Kingston Springs through that section of Cheatham County. Keep that in mind as you come in from Dixon County. Again, it's been that way for the last couple of days with some slow go traffic there in Kingston Springs. It's heavy as expected on I-40 in from Mount Juliet. They've just moved the damaged vehicles involved in that earlier crash on 40 westbound there at Spence Lane just past the airport. Nash Painting, they service all of Middle Tennessee and they do a great job at it as well. Check out their reviews. They're awesome. These guys are the best. Log on today, nashpainting.com. I'm Commander Chuck with your on-time traffic.
The refreshing cool after coming in from a hot summer day. The perfect temperature to kick off your shoes and relax with a good book. When the weather heats up, a new Rheem AC system will surround your family in total comfort. Are you feeling it? Rheem, the new degree of comfort.
Financing available through TVA's Energy Right program and your local power company. Call Randy's Heat and Air 237-3604.
Rheem, the new degree of comfort.
Where a patient starts their cancer care matters. And here, that means Vanderbilt Ingram Cancer Center, Wilson County. It's Vanderbilt level care without making the drive to Nashville. From screening to diagnosis to treatment and recovery, patients can get all the care they need right here close to home. So now, having the best care team and most advanced treatment is closer than ever. Vanderbilt Ingram Cancer Center, making cancer care personal.
Coleman & Company here on a Tuesday morning. Thank you for joining us. We thank you for listening. I know we have a lot of people who tune in each day. We thank you so much. And my thanks to Brian Hutto. He is one of our regulars now. And we sort of have this set up. It doesn't always work that way where you come after each school board meeting, but we've pretty much got our calendar fixed for the next, through next July, I believe.
That's correct. We're in good shape.
Unless something comes to prohibit, we both know when you're going to be here.
And we're excited about that. And I've said it before, we really value this time. Your audience, it's a good audience, and we like to share the good things that are happening. So
all right. Well, you kind of teased everybody before the break what we're going to talk about here. You got some good information for us.
Sure. So as I mentioned before break, we had a big emphasis from our board, and from our families that safety should be a priority. There have been issues that have happened around the country, and we don't want those to happen here. So what are proactive measures? And so one of the ones, our board back in the spring, we approved, and you're going to be you're the first rollout, Coleman. We talked about where do we want to share this, and in my brain, Coleman is the place where this can be. So our board approved a canine implementation. It's called Paws on Patrol. And this is not, I'm not going to give all the details because we want to do an official welcome, but he started yesterday. We have canine unit. He is German short hair. He's floppy ear, sweet looking. He's not the German Shepherd type. And he works off of, it's a detection dog. It's not aggressive. You can pet the dog. And of course we have a handler. Mr. Dusty Burton with Sheriff's Office. And so this is a partnership with Wilson County Sheriff's Department, Lebanon Special. Our board really jumped in, and so you'll see our dog making the rounds.
Petted the dog.
I petted the dog yesterday morning. As I walked in the office, that was the first thing I saw. And he is sweet, but you can tell he wants to work. He's eager to please. So you're going to get much more, but that's the teaser for folks when they see. We didn't want them to think that's a Lebanon Special employee making the rounds.
What exactly will it be able to detect, say, drugs?
Gunpowder. Gunpowder is essentially, and there are other facets to it, but the big one is called a vapor detection. And the technology, and we use that term technology, is really amazing what it's able to do. So it can be, before it came to us, it's been in training for the past, his name is Blaze. I need to just quit calling him it. Blaze was in training, and so, for instance, you might see Blaze or that type at a Braves game. That was what part of his training to certify, and they just walk around the crowd, and they're just can smell all of the things. And there are signals between he and the handler to alert if there's something off, and then the handler can intervene, can follow. So it is a really preventative measure that'll just be out and about.
And something totally new.
Totally new.
Never done this before.
Totally new. I thought we were the first system in Tennessee, and that's really not that important. But there is another system east that is implementing as well. And so the company is Global Canine. They're all over the United States, all over the world, in fact. And Blaze actually came from Germany originally, but he will be the first school system. So we're excited to pilot this and let our kids have. They do this in Texas, and the dog actually has an Instagram, and people take pictures and they post, and so that part's good. But the safety aspect, and I need to give kudos. It's parents that brought this to us. We had a couple of families that were doing some research and said, hey, would y'all take a look at this? Can we at least talk about it? And so another testament to partnerships, and those families, will invite them when we do the official welcome here in a couple of weeks. But that's a big item that we're excited about with our overall safety.
Thank you for telling us all about it this morning.
Sure.
At least all that we need to know.
Yeah. That's about all we can do. And several of these things. Another one, Jeremiah Van Treese with Lebanon Police Department. Folks probably know him. He is part of the DARE program. So DARE, some folks may remember, when we were younger, we had DARE. That was a federal program that sort of phased out. And we realized the need for that educational piece, but also the partnership and relationship. So Lebanon Special started DARE back up last year, and it was a part-time, it was a partnership. Our board, once again, taking the initiative. We have a full-time DARE officer. Jeremiah Van Treese will be in our schools every day. He'll be providing instruction, making good choices, lots of different aspects to the curriculum. But that's another individual that we'll have available.
At one school today, a different school tomorrow, or how does that?
So he'll be scheduled as far as the curriculum piece, but other than that, he'll be. We don't ever want to pin somebody down. So the goal with our canine unit, also with our weapons detection with Officer Van Treese, is that we can't say it's 10 o'clock, he'll be here.
Right.
We want the ability for them to be wherever. So excited about that.
There will be some classroom instruction in the DARE program.
Correct.
And an opportunity to have an officer really for a teacher for a little while.
Yeah, that's exactly right. Be a good role model, good relationship. We have really, we talked about blessings already twice, but our law enforcement agencies with Wilson County Sheriff's, Lebanon Police Department, emergency services, we're in really good shape, and they're good partners for us, and we appreciate it very, very much.
What else you got this morning?
Hey, another one we're excited about. So when we talk safety, there are unseen elements, and so I won't necessarily go into all of those, but we want our families to know that if it's a technology that we think will benefit, we're either using it, entertaining it, or talking how we implement. But before we get into safety, that emotional health of students and families, and that's been a big topic, and it's in the news. Kids need to have, they need somebody to talk to. Families need somebody to talk to. And one of the things that we've run into is if we have a student or a parent that needs services beyond the school, because We're highly qualified to teach. We're good at subjects. We need professional resources that we can point them in the right direction. So Care Solace is a company. Their location, I think it's Georgia, but don't quote me to that. They're essentially a clearinghouse for mental health professionals. So you can anonymously, let's say Coleman had a grandchild that wasn't sleeping, had anxiety. You could log on within 3 minutes, 10 minutes. Someone's going to call you if you want them to. They're going to set up the appointment for you. They're going to get your insurance information. They're going to do everything for you with providers within whatever range you decide. So all of the hoops and steps, they're going to take care of it. And that'll be available to all of our families, all of our staff. And it's a resource we implemented last week, and we've already used it several times.
But this is totally new for now, a week old, let's say.
Week old, totally new for Lebanon Special. We really like the advantage of, as I said before, there's only so much that we can do, and we'll do everything. But when we need that professional support, Care Solace can jump in, and we're excited about it.
Well, you do have a lot new to talk about this morning. That's
we do.
Sure.
We do.
But it's you're kind of changing with the times, adapting to new situations.
Certainly, and the phrase is nothing's stagnant. It's either forwards or backwards, and we really are excited. This is steps forward. Our staff and the board, taking the time to really think about how do we continue to improve, because that's the goal ultimately. And academically, we feel good about our work.
Well, let me just throw this out for a second here. I know the special session of the legislature is coming up next week. In fact, I've got Senator Pody is supposed to be here Friday and talk about some of that. I just wonder, a lot of this has to do with gun safety, with all of this, and the school shooting actually prompted this. Are you involved in you got to have your ear to the ground, so to speak, to know what's going on here, and just wondered to what extent you might be thinking about this and the members of the board.
Correct. So special session, gun safety is an aspect of it. The one that's really important, well, they're all important, but the one that we're going to land on, or that was mental health supports. It's critical that we intervene before the tragedy happens or before they get to a place. And so we feel like Care Solace is a good step. Additional item for Lebanon Special, we added guidance counselors. We added one to all of our middle schools. Our goal is to add one to every elementary school, so we have two. So what I would look for, I hope, in the special session are those abilities for us to be creative with licensure for guidance counselors. Those are the conversations that we'll be having. We've got a partnership with the university, and so we have people that are in the program, and we want to be able to snag them and say, hey, we've got a spot for you. But it's important that they have the right certification, the right training, and so I think that'll be an item that they'll discuss, mental health professionals. Yep. So, lots of things.
All right, I sort of interrupted you there. What else you got? You've got about 3.5 minutes here.
3.5 minutes. So we'll do a plug. So every year, a big part of the July board meeting are board policies, and we had a host of them. There are 20 plus. And so just for folks to understand, the legislature makes laws. We have Tennessee School Board Association, then takes the laws and looks at your board policies, and they'll give you recommendations, or they'll give you model policies. From there, our school board members, they sit down, they look, they decide if they want to accept, which would be ideal, adjust or add to. And so that was a big part. We did the budget, which is huge. And then they went through all of the policies, thoughtfully looked at them, added any changes. Most of them were minor. It could be some language or some verbiage or dates. That was the other big thing. Next time we talk, we'll have some data, some scores. Excited to share those. So it's been a great start.
What your enrollment figures? Do you have those?
We do. We're sitting at 4,263. So we ended the year right around 4,300 and maybe a little change. So pretty level. We'll get a push after Labor Day. We have folks that move in, and for some reason that's a good time to move. So yeah.
Well, no doubt you have your eye on every new apartment complex that comes out of the ground. You know where building is taking place. You have to keep up with that in order to adjust your school zones even and that sort of thing. But are you anticipating this enrollment to stay about like this, or quite a big increase by the end of the school year?
So that's the tricky part, Coleman. The developments, they're everywhere, literally everywhere, and so what we're seeing not necessarily is that all of those have school-age children. Some of them have older children, and so we'll have to watch. We're prepared. We've budgeted in additional teaching positions. So if our enrollment in a school, in a class, in a grade increases, we'll add a spot. So and we have room in certain buildings, and certain buildings it's getting tight.
Yeah, and you don't always know which area is going to have the biggest increase, and you might have more room at one school than the other. The growth might be somewhere else.
That's exactly right.
The adjustment part.
That is exactly right. And we have that. We've got two buildings that have more than some of our others, and it is just where the growth has landed, but also people are settled. So we're hoping that we have a year that's pretty stable. It's coming though. There's no doubt, and that's why we purchased the property back in the spring. We're working on pre-planning so that when our numbers dictate, we'll be ready to go.
All right. Well, that kind of brings us to the end of our program this morning. Thank you for listening. And Brian Hutto, thank you for being with us, Director of Schools for Lebanon Special School District. We've had a good program this morning. Thank you for all the information, and we'll see you next month.
Thank you.
All right. That's going to do it for this Tuesday. I hope you'll join us tomorrow for the Wednesday edition. And until then, I wish you a terrific day.